Welcome to Autism Parenting in Nigeria. I am Dr. Chisom Pascaline, a medical doctor and a certified autism specialist. Welcome to this series on how to know if your child has autism. Today, we'll be talking about autism versus speech delay. Is it autism or is it just speech delay? Many parents are told he's just a late talker. He's just a late talker. Boys talk late. Don't worry, he will catch up. But sometimes it's more than speech. So let's break it down. What is speech delay? Speech delay means that a child understands the language but struggles to express it verbally. The key signs of an isolated speech delay include the child responds to name, if the child can turn when you call, makes eye contact, points to request things, uses gestures like waving, understands simple instructions, tries to communicate non-verbally. The main issue here is spoken words, not social connection. So the child does every other thing normally, just that the child is not able to verbalize. So what is autism? Autism is a neurodevelopmental condition that affects communication, social interaction, behavioral patterns, and sensory processing abilities. Speech delay can be a part of autism. Autism involves more than just talking. So what are the key differences? Number one, response to name. Speech delay. If it were to be speech delay, the child usually turns when the name is called. For autism, the child may not consistently respond to the name. Eye contact. For speech delay, there is normal or near-normal eye contact. For autism, it's grossly reduced. It's brief or avoidant completely. Gestures. In speech delay, the child uses certain gestures like pointing to show you things, waving, clapping, giving high fives. For autism, the child has limited or absent gestures. Number 4, social interests. In speech delay, the child wants to play with others. In autism, the child mostly prefers to play alone and have limited or isolated interests. They may not engage in pretend play. Number 5, repetitive behaviors. For speech delay, this is typically absent. For autism, it may include hand flapping, spinning objects, lining up toys, intense interest in specific items, rocking, pacing, and all of that. Number 6, sensory sensitivities. For speech delay, usually typical sensory responses. They don't have issues with sensory responses. But in autism, most times they overreact to noise, to light, to texture, to certain foods. So you may just find the child rejecting certain foods based on the texture, certain fabrics, clothing based on the texture, or even touch. They wouldn't want you to touch them and all of that. So all those ones are sensory activities. So when should you be concerned? You should seek for professional evaluation if your child does not respond to the name by 12 months, has no pointing by 14 to 16 months, has no meaningful words by 18 months, loses previously acquired words, that's regression, avoid eye contact consistently. Early evaluation does not harm. Waiting too long can actually delay intervention. So what's important for our dear Nigerian parents? In Nigeria, many parents are usually reassured. They're reassured too quickly. They're told that boys talk late. They're told his uncle talked at 4 or 5 years. Don't worry, it will still happen. Yeah, while we're not disputing all of that, seeking early intervention is not harmful because this will help with structured early intervention. So, not everyone is a late talker, and not everyone that actually talks late has autism. So, every child that has concerning signs deserves proper evaluation. If you're not sure, don't panic and don't Google yourself into fear. Seek for evaluation from qualified professionals. If you're concerned about your child's development and need structured guidance, explore our Autism Progress Tracker and other early intervention resources from our website. Thank you and see you some other time.